14th week of pregnancy, second trimester, only good things happening. If by chance you are still not feeling so well, have a little patience that the tendency is to improve. Yes, you are entering one of the most enjoyable phases of pregnancy, which does not have all those discomforts of the first trimester. Okay, some are still a little bit, right? And it won't have all the weight it has there at the end. So if you want to know what's happening to your body, what are they? These are the news, everything about your baby, a feeding tip, and a special tip for this week. Stay with me and I'll tell you. Hello, I'm Monica Romero. I'm very happy to have you here with me. I am the creator of the series Pregnant Week a Week on YouTube Brazil, and I am re-recording this series with the main news about you and your baby. And let's start by talking about you. Her uterus has grown so much that it's the size of an avocado. Can you believe it? No? That big bacaton, that's avocado, you know, the one that's a little smaller? Your uterus is growing a lot. And with this, it becomes more difficult to hide the pregnancy, even if you have chosen to keep it a secret for longer, which is also common to happen. Soon the questions will start. People will start to suspect that there is a baby coming around. There are times when you can't hide it anymore. And remembering that tight clothes make you feel nauseous. So it's time to start investing in some clothes that are more appropriate for that moment. It can already be maternity clothes, and several can accompany you throughout the final of your pregnancy, even during your breastfeeding, are good investments to make. Or even the looser clothes that you have as a dress or gym clothes that leaves the belly a little looser will help you. And if you have any piercings in the belly or even in the breasts, consider staying for a while without them. Because with the growth of the belly and the sensitivity of the breasts, they can even end up inflaming or bothering you. And if you don't want it to close every 2 days, disinfect it. It's there, you're piercing and past the hole to not let it close, agreed? You may have already noticed the darkening of your halos and even the growth of them. This happens because of a hormone called melanocyte, which is what makes the production of melanin. This means that the baby has a greater contrast there when seeing where his mommy is. But it can also cause the black line. The black line I will leave here for you. It is a line that comes from the groin and it can reach the abdomen. Not all women will have this line. Some will only go up to the navel and it disappears a few weeks after giving birth or even a year after giving birth, as was my case. My case took a year to come out, but it totally comes out and it has no function. In fact, during pregnancy, it is just a reaction due to melanin. And this melanin can also bring you melasmas, which are those darkened spots on the skin. If by any chance you had melasma when you were on birth control, your tendency is higher, so you have to be more careful. Always use sunscreen and no cosmetic or treatment products during pregnancy. Without the release of your obstetrician, these are treatment. I don't know of any that can be used during pregnancy, but you can use sunscreen even at home. Your breasts, despite being they're more rigid, less sensitive, the production of colostrum has already begun. However, nothing to stimulate, okay? But it showed nothing to stimulate, okay? During the medical consultation, the doctor will do a stimulation to see if you already have colostrum or not. If not, don't worry. If you already have anything to stimulate at home, don't do it, okay? Breast stimulation can cause contractions, which is not what we want at this moment. So breast stimulation, for now, no nanoline. Don't try to force or test to see if colostrum comes out. You can let the doctor do it at the right time, okay? If the baby is growing a lot, and it will grow very fast until about 2526 weeks of gestation, and then after that, it will start to gain more weight. In this part of growth, we only talk about measurement from head to butt, okay? So he's measuring between 8 and 9.3 centimeters and weighing between 40 and 50 green. This week, one of the biggest news is that he now has taste buds. What does that mean? That he can already do differently. This one tastes sweet and salty, that is inside your amniotic fluid. What do you mean when we eat something, when we ingest some food? The baby can feel a little of their flavor in the liquid that he has been swallowing since last week. Do you remember that? I'm going to leave linkado here so you can see how he's already started swallowing. What we eat ends up passing the flavor to the amniotic fluid, and it begins to become familiar with these flavors. So diversify your diet. I won't even put this tip. Nutrition. This is the tip for your baby, huh? For the development of your baby's papillae, for him to have more acceptance with flavors, take care of the diversity of what you are eating. This is very important. Remembering that your little baby, he is immersed inside the amniotic fluid and connected to mommy through the placenta. The placenta is an organ. What does that mean? It is an organ that we develop only during pregnancy, and after the birth of your baby, we will also expel it. We will also give birth to this placenta. The placenta will also come out. It stays, it makes the connection. It is from the woman's body to the baby's body. In the woman's body, she makes the connection through the uterine wall, and in the baby's body through the umbilical cord. The umbilical cord, it has one vein and two arteries. The vein is what will bring clean blood, full of nutrients and oxygen to nourish the baby. And after this blood has passed through it, it will return to the mother through these arteries and thus get rid of it. And we will play the role of filtering and bringing new blood to this baby later through the vein, okay? So this purification is done through your body. And yes, all the food your baby is getting to him through the placenta. However, the placenta, despite being an incredible protective barrier, medications, some foods and chemicals such as creams, such as dyes, such as bleaches for hair straightening, can penetrate it, okay? They can penetrate it, including through our skin, they can penetrate. Do not need to ingest. So before using any product, morning, or taking any medicine, talk to your obstetrician to see if it's safe for you and your baby. Right now, your baby's neck is already beginning to form. It is already beginning to elongate, however, as he does not yet have muscle. It is not yet firm. The baby's little head still has to rest here on your chest. Last week, with those movements in the amniotic fluid, they began to form your baby's fingerprints, which are unique, even in univitelline geniuses. Speaking of twin pregnancies, if you are a mother of two, are expecting 2 or more babies, it is obvious that your belly will be larger than the single pregnancy. However, all information about the baby's development, including the size part, still coincides with pregnancy of single babies. When this difference starts to happen, you can let you know, but for now, you can follow the pregnancy week by week here that they REM for a single baby, twin multiples like. If they are, that's fine. And finally, something new that I think is really cool about the baby as well. Now, during prenatal appointments, the doctor will feel the belly and he will start to notice the baby running away. Look, that naughty baby now starts to run away. And as he already has this motor control, he is already able to explore, touch, feel. If he sees something moving, he can hide too. Look at that. And my eating tip for you this week is that you have a higher red blood cell count than you had before you got pregnant. So to be able to have a nice count so that you don't miss this production, so that it doesn't fail, you have to have iron. And where is it? We find iron in red meats, cereals, and dark green leafy greens, such as broccoli, spinach, for example. So let's take care of the intake of these foods. And for the tip of the week, I have 2 tips for you. Today, I'm not skimping on tip, no. The first is that if you already have a child, how about taking advantage of the fact that your disposition is coming back and doing some programs with this puppy? It's natural for him to feel jealous. It's natural for him to realize that there is something happening there. He must have already realized that there is something, and he is careful not to say that his little brother is coming to play with him if his child is small, because he will have the expectation that the newborn will arrive playing. So no, we have to say that there will be a tiny little baby Tangelinya who doesn't even know how to pee properly in the potty, who only pees in the diaper, and that we have to help him become a very nice guy who is not even our firstborn. And my tip number 2 is for you to start thinking slowly about trousers. What are we going to have to do Will you have to do some work in the room? Will you have to do some painting? Start organizing all this. If you need to see 11 architect, it's time to start talking to these professionals to do your planning so you don't have to do everything rushed up front. The part that takes the most time is the part of works, if necessary. And large properties, some furniture, for example, such as the crib or even a wardrobe, they can take from 23 to 4 months to be delivered, depending on the supplier or even the time of year we are. So it's important that you start planning all this. When the time comes, you can let me come here in the almanac and tell you which week you should already have everything prepared, but you already start looking for this information, okay? I hope you like these tips. Congratulations on your 14th week of pregnancy. Don't forget to enjoy. And also to mark a pregnant woman who must already know some pregnant women out there. We recognize each other on the street, right? He points to her parents' almanac. I came here too, and I'll see you in the next video.